Words, and thank you, Dr. GVK, for the invitation to speak on this very interesting subject. As Dr. Moses was saying, young professional and dyssomnia, circadian rhythm, anxiety, erectile dysfunction, etc., etc. You can see here, these young people work at odd times. They work at the times when most of us tend to go to sleep, and they are very, very sleepy when they work. And they eat at odd times. You can see here they eat at odd times. When they come back home, they have no sleep at all. And that's because the entire disturbance of the circadian rhythm. And this rhythm gets disturbed, therefore their entire lifestyle changes and they fall or they succumb to all these complications. And this circadian rhythm was well known way back when Hippocrates and Aristotle have described about this situation. And it took almost so many years till 2017 till these three great scientists from USA discovered the molecular mechanism why you get these problems of disturbances because of circadian rhythm. Now when you talk of circadian rhythm, this is what actually happens. When you get up in the morning, the levels of melatonin drops down, your movement of bowel starts, the corticosteroid levels go up, there is extremely good muscular activity at about 4 p.m. and you're extremely alert at 10 a.m. in the morning, and you go off to bed by say about 10 o'clock, and then by deep sleep is at about 2, and that's time when the temperature again starts rising and wake up in the morning. This is a classical circadian rhythm we have to follow as we go along. Now who controls this rhythm? And there are special neurons, 10,000 in number, in the place called suprachiasmatic nucleus in hypothalamus, which works like a clock, and it's called a central clock. And you can see the multiple clocks are there, and these clocks oscillate with the central clock. And who gives the feedback to this? The light is the most important feedback. It's a light which gives you feedback to this suprachiasmatic nucleus, and that in turn oscillates with all other clocks in the body, namely in the muscle, in the heart, in the intestine, in the liver, and so on and so forth. Besides that, there are other kinds of feeds which are especially the food, and these are called Zeitgebers. And these food called Zeitgebers and the activity also keep on feeding the suprachiasmatic nucleus, and that's why you get the fantastic oscillations occurring between all these clocks. And when there is disturbance in these clocks, when the disturbance in these clocks occur, when we have no proper oscillation, you can see these people suffer from cardiovascular disease, disrupted sleep, cancers are known to occur, strokes can occur, and a lot of disturbances in the mind, depression, anxiety, so on and so forth. So this is what actually you see in patients who come with these kinds of problems. Now how this light is sensed? Even the blind people who are actually blind can identify which is the daytime, which is nighttime. So there are special cells in the retina which are called melanopsin producing cells. There are just 5,000 in number, and these are the ones which sense the blue light. So the blue light is an important light which keeps you awake, and that's how the blue light is supposed to be very bad, and that keeps your body, mind alert. And what happens is, in the daytime, when you go near close to the window, even if it's a cloudy day, the 2000 lux illumination of the light is sufficient to stimulate the melanopsin, which is a special kind of a neuron located in the eye. But when you have a candlelight dinner, that light is very small light and it does not stimulate melanopsin, therefore you don't lose the sleep at night. But you eat your dinner in a brightly lit place like this, you will certainly miss your sleep because this light will stimulate melanopsin and therefore your sleep will get disturbed. Now what actually happens with these young people? They stay indoor with all these blue screens of either television or the computer or the laptop or the mobile phones, and that stimulates the melanopsin, so their sleep is destroyed at night. In the daytime, they stay in a gloomy area, and because of that, there is a misalignment of the circadian rhythm, and therefore that reduces their activity in the morning, so they remain dull and that reduces their performance. So they can't work well at night and they can't work well at daytime. So both ways they suffer. So this is what I said, that the blue light is important, which is important stimulus for the suprachiasmatic nucleus, and all these peripheral clocks act And the most important also is the food, which also brings about this stimulation of all these clocks. Therefore, this also is called as Zeitgeber, which also acts like this. So then what happens when you have disruption of the circadian rhythm? All these diseases are known to occur. So when your cycles are disturbed, you get all these possible complications of disease, no matter the young born or a teenage or elderly people. And when this clock gets set, as the baby is born, by the 6 months of the age, these clocks get reset, and therefore the baby starts sleeping properly in the night time and remains less awake in the night time. Now, what is the proof for this? This is a very interesting experiment which is done on mice. And mice is basically a nocturnal animal. And what they think was in the top circle that you see, the mice was given the food both at daytime and nighttime. Actually, the mice supposed to eat only at night, but the food was given both the times, daytime and nighttime. And the mice is given food only at nighttime. And both of them had an isocaloric meat. And both of them had a same kind of environment in which they were living. What you see here, the mice which ate both daytime and nighttime, same caloric food, became obese. Their fat increased body 70%, and the body weight also increased by 28%. And what you see further, that there is a change in the liver biopsy. There was a fatty liver in the mice which eat both daytime and nighttime versus the mice which ate only at the night. Changing the diurnal pattern of eating can bring diseases, especially the diseases of fatty liver and atherosclerotic cardiovascular disease. So this is what is important, why it's important. Here you can see on the top, in man, we normally consume glucose in the daytime. In the night, we're supposed to consume fat. And therefore, when you eat in the morning and you stop eating at 6 p.m. in the morning and then don't eat anything after that, the fat burning starts. When the patient says, I lost weight, how does he lose weight? He loses weight because he burns fat. And why do you burn fat? Because you stop eating, then the switch gets activated. And that activation of switch starts burning the fat, and therefore you lose weight and also you remain healthy without restricting calories. This is a very important aspect, that the switch has to be activated. What do we do now? We have late dinners, we have late parties, and therefore we keep on indulging in eating excessively at night, and therefore the switch doesn't get activated. Now, what is the proof for this? This is an experiment done on people who are working in the laboratory. There are 9 of them, and they were made to restrict their food timing, the delayed breakfast and early dinner. The red lines you see are those people who are eating same food, but over a longer period of time, and the blue line that you see in people who ate the same food in a shorter duration, the late breakfast and early dinner. And what you see in the right side, on the left of yours, that they lost weight by 2 to 3 kilograms. This study was actually planned for just 1 year, but these people continued the study for next 1 more year. People ask, why do you continue that? Because these volunteers said that we continued this because we felt better, we could sleep well, we lost weight, and it did not require much restriction of calories, and we felt healthy. So this is a very important experiment which talks about the restriction of the calories. Without restricting calories, you get the benefit. Now, why this should happen? It happens because I was talking about branched amino acids. It was the same question I was asking Dr. P.V. Rao, the branched amino acids. Now, these branched amino acids are actually dumped into fat cells. That's how it is supposed to go there. But when you have the type of eating in the odd ways, the same branched amino acids are dumped into various tissues, namely the liver, the heart, and the kidney and all those organs, and that brings insulin resistance. And that's why the consumption of large amount of branched amino acids is supposed to produce diabetes because of this particular phenomenon. Now, a lot about these young professionals, they look like zombies, and this is because they can see that they report sleeping more at the work time, and they also feel that they are not rested enough. Most of them remain absent, and this is exactly what happens when they work late time, and most of these shift workers come to you and complain to you like this. Now, what exactly shift happens? It happens because of the malalignment, eating behavior and metabolism gets changed, and therefore they develop the various cardiovascular disease, cancers, atherosclerosis, hypertension. So what is a shift worker? What's the definition? A definition is anybody who spends more than 3 hours. Mind you again, anybody spends more than 3 hours awake between 10 p.m. to 5 a.m. on 50 days, means once a week, for 1 year is called as the person who works as a shift worker. That means all of us sitting here are actually in that sense are shift workers. And therefore we are prone to get all these diseases which I mentioned just now. So they have to be careful and try and appreciate this factor very well. Now what are the professional problems are? The professional blues, they get this disturbance of circadian rhythm, they have the problems of sleep, and they also have social problems. The second thing I mentioned to you earlier, that the suprachiasmatic nucleus and the Zeitgebers, if there's a good concordance, the person remains happy. But if there's a discordance, you can see the suprachiasmatic nucleus and Zeitgebers fighting with each other. You can see this person unhappy, grumpy, sleeping during the day, not eating at all, and caffeine many times. All these young people drink a lot of coffee. And once you drink the coffee, the effect of coffee lasts for 6 hours. In South India, they drink a lot of coffee, and that effect lasts for 6 hours. If you take coffee at 5 p.m., you will certainly not sleep till 11 p.m. So therefore, it's important not to take coffee after 2 p.m. So this is what actually happens in people who have this kind of shift worker. You can see the activity changes, the levels of melatonin, the cortisol, the body temperature, the oral mucosa, the peripheral monocytes. All these changes can occur by change in the shift, resulting into all those diseases, which is called a social jet lag. When you eat later part of the day, it's called a social jet lag, and this is exactly what happens to this. There's also a problem in the sleep. What exactly happens is we have two kinds of sleep. The rapid eye movement and the non-rapid eye movement sleep is quite normal, what you see there. And the lower pattern you can see here that the rapid eye movement is deprived in patients who work like this in the later part of the day. So that's a deprivation of rapid eye movement, which results into impaired complex task learning, irritability, it increases the appetite, and therefore it increases attempts to get back to the rapid eye movement sleep. And this is exactly how it's understood. The sleep has two components. One component which is called as the homeostatic component, which is shown here by the dotted line, and the second line is what is called the circadian complex. What's important here, that this builds up over a period of time, like roller coaster, goes up and up and up and down, and at the same time the circadian rhythm also comes in. And when you have a disturbance of sleep, this gets discordant, and therefore they have this particular problem. And more important, that this problem of people who work in the shift work can remain beyond even if they stop working in the shift. That's good. The legacy effect is also there. And therefore, the digital addiction in the sleep is a major problem, which is called a death by digital distraction. And these are the various kinds of neurohormones in the brain, like serotonin is the one which is responsible, which decreases the dopamine level and therefore brings about a lot of changes in the patient's mind, and therefore these patients get addicted to the computer screens or the mobile phone. They keep on watching. A lot of people tell you that they keep on watching movies on the mobile phone. That's because of the digital addiction. And all these food that they eat, that they have that also causes increased anxiety and depression, and therefore these patients have a lot of problem because of this. The other interesting aspect is the microbiome. Dr. P.V. Rao talked about microbiome. We have more than 2 kilograms of microbiome in our intestines, and what has happened, if you have taken properly in your proper time food, the oscillation of microbiome is normal. The study was done in patients of impaired glucose tolerance, 39 in number, and they were made to exercise. And after making exercise, there were some who are responders, some are not responders. How will you identify who's responding? Look at the microbiome. If you look at the microbiome, those responders will produce short-chain fatty acids, they'll increase the GABA production, and they'll produce increased branch-chain amino acids, decreased branch-chain amino acids. So therefore, these are the one who responds. So whether you respond to exercise or not doesn't depend upon your muscular activity. It depends on your microbiome that they're in the intestine, and that tells you whether you are efficiently doing exercise or not. So there are some social concerns we have. We have the increased divorce rate because of that, less marital satisfaction, high suicide rate, high substance abuse, and so on and so forth. And therefore, these are the problems. Ultimately, this is what the patient will have. There are all these problems, the gastrointestinal problems, increased cancer, especially the breast cancer, the colorectal cancers are described. In fact, WHO said that the shift workers have the increased propensity to develop various cancers, especially the breast cancers. And then we have the problems in the reproduction, the cardiovascular disease, increased risk of heart attack by 40%. And what can we do with all this? First of all, they educate the patient's relative and the friend who work with him that there is a kind of a deprivation of sleep which will make them make more errors. The casino shift is, 1 minute more, just last slide. The casino shift is one important thing where you can change over at 4 a.m. instead of 7 a.m. shift change, because the person goes home in the night itself and can go off to sleep and can catch up with the rhythm to some extent. Then when the person sleeps in the daytime, keep the black curtains, keep the area very cool, quiet, mobile phones on their vibration, see that the bells don't ring and therefore they don't disturb. The anchoring sleep is very important. What does it mean? Whenever the person sleeps, works at odd duties, odd time, the sleep pattern should be the same. He should sleep 4 hours on the days when he works in night shift, and on the day when he's off, he should sleep again 4 hours during the same time. For example, from 9 a.m. to 2 p.m., that's time you must sleep. That's called sleep anchoring, which is very important concept in treating these people to prevent the cardiovascular problems in these patients. And the moment they get up, they must exercise. And when they're in the morning time and they're awake, they should have bright lights, because bright light will stimulate melanopsin. So what is the final slide of mine? What should we do? We should sleep at least the time restricted eating. Eat your time eating between 9 or 10 a.m. to breakfast and 6 p.m. dinner. If you maintain the 8 hours window of eating, you can have a good therapeutic, good window of the eating problems. Second, do not have coffee beyond 2 p.m. If you have coffee beyond 2 p.m., then that coffee will interfere with the sleeping pattern at night, so you will not get adequate sleep, you'll be sleep deprived. Exercise should be done at 4 p.m. That's a time when the exercise is the best kind of a productivity, because the muscular activity is maximum at 4 p.m. So tell your patients to exercise around that time. And finally, if we can do this, the disrupted clock can be brought back to the normal clock. So the most important thing, it's not what you eat, it's when you eat that matters. So eating is very important, but when you eat is important. I just want to request the chairpersons, I have a lecture at 12 p.m. again, 12 noon. If you have any questions, I'll be happy to answer here. I can join that lecture. I won't have to wait again.